Welcome to a journey inside the lungs, as we explore a fascinating and sometimes challenging condition known as pulmonary aspergilloma, a type of aspergillosis. Join us as we unravel its mysteries, from its origins to its management, and discover the latest advancements in tackling this unique fungal infection. So, what exactly causes this lung condition? Pulmonary aspergilloma is primarily caused by the fungus Aspergillus, most commonly Aspergillus fumigatus. This fungus is virtually everywhere in soil, decaying vegetation, and even the air we breathe. While most of us inhale Aspergillus spores daily without any harm, problems arise when these spores colonize pre-existing cavities within the lungs. These cavities can be remnants of old tuberculosis infections, emphysema, or other lung diseases. The fungus thrives in these spaces, forming a fungal ball or aspergilloma, which is essentially a tangled mass of fungal hyphae, mucus, and cellular debris. Now, let's delve into how the fungus causes issues inside the lungs. When Aspergillus spores enter a lung cavity, they begin to germinate and grow, forming hyphae, which are thread-like structures. These hyphae intertwine, creating a dense fungal ball within the cavity. This aspergilloma is not just a passive mass, it can trigger several detrimental processes. Firstly, the fungal ball can physically obstruct the airways, leading to breathing difficulties. Secondly, the fungus can irritate and erode the surrounding lung tissue, causing inflammation and even bleeding. Finally, the presence of the aspergilloma stimulates the immune system, which in turn can cause further inflammation and tissue damage in an attempt to fight off the fungus. This chronic inflammation is a key feature of the disease. Pulmonary aspergilloma isn't considered a highly prevalent disease, but its true incidence is difficult to determine. It's estimated that it affects a small percentage of individuals with pre-existing lung cavities, particularly those with a history of tuberculosis. People with compromised immune systems, such as those undergoing chemotherapy, organ transplantation, or living with HIV/AIDS, are at a higher risk of developing more invasive forms of aspergillosis, though pulmonary aspergilloma itself is less directly linked to severe immunosuppression than other aspergillosis types. The occurrence is worldwide, wherever Aspergillus is present, which is practically everywhere. The symptoms of pulmonary aspergilloma can vary significantly from person to person. Many individuals may be asymptomatic, meaning they experience no noticeable symptoms at all, especially in the early stages. When symptoms do appear, they often include a chronic cough, shortness of breath, and wheezing. A hallmark symptom is hemoptysis, which is the coughing up of blood. This can range from a small amount of blood, streaked sputum, to more significant bleeding episodes. Other potential symptoms include fatigue, weight loss, and chest pain. It's important to note that these symptoms can mimic other lung conditions, making diagnosis challenging. Diagnosing pulmonary aspergilloma often involves a combination of imaging techniques and laboratory tests. A chest X-ray, or more commonly, a CT scan of the chest, is crucial to visualize the aspergilloma within the lung cavity. The CT scan can reveal a characteristic air crescent sign, which is a crescent-shaped airspace surrounding the fungal ball. To confirm the diagnosis, laboratory tests are essential. Sputum samples can be examined under a microscope to identify Aspergillus hyphae. Blood tests may be performed to detect antibodies against Aspergillus. In some cases, a bronchoscopy, a procedure where a thin, flexible tube with a camera is inserted into the airways, may be necessary to obtain samples for further analysis and rule out other conditions. While the term pulmonary aspergilloma generally refers to the fungal ball within a lung cavity, it's worth noting that it falls under the broader umbrella of aspergillosis. Other forms of aspergillosis include allergic bronchopulmonary aspergillosis, ABPI, which is an allergic reaction to aspergillus in the lungs, and invasive aspergillosis, which is a more severe and life-threatening infection that typically affects individuals with severely compromised immune systems. Pulmonary aspergilloma is often referred to as a chronic or simple aspergilloma, to differentiate it from these other types. The treatment and management of pulmonary aspergilloma depend on the severity of the symptoms and the overall health of the individual. Asymptomatic patients may not require immediate treatment, but will be closely monitored with regular imaging. Symptomatic patients may benefit from antifungal medications such as itraconazole or voriconazole, which help to suppress the growth of the fungus. However, antifungal drugs often have limited penetration into the aspergilloma itself. In cases of significant hemoptysis or severe symptoms, surgical removal of the aspergilloma may be necessary. Another option is embolization, a procedure where blood vessels supplying the aspergilloma are blocked to reduce bleeding. Often, treatment involves a combined approach of antifungal medication and surgical intervention. Bronchial artery embolization has become more widely used to control bleeding. Preventing pulmonary aspergilloma primarily involves managing underlying lung conditions and minimizing exposure to Aspergillus spores, especially for individuals at higher risk. This includes avoiding environments with high levels of dust or mold, using air filtration systems, and ensuring proper ventilation in homes and workplaces. For individuals with compromised immune systems, prophylactic antifungal medications may be considered. The prognosis for pulmonary aspergilloma varies depending on the individual's overall health, the severity of the symptoms, and the effectiveness of treatment. While the condition is not typically life-threatening, it can cause significant morbidity due to recurrent hemoptysis and chronic lung disease. Surgical removal of the aspergilloma offers the best chance of long-term resolution, but it's not always feasible due to the patient's underlying lung function or other medical conditions. Recent research focuses on developing more effective antifungal medications with better penetration into the aspergilloma. Studies are also exploring the use of immunotherapy to boost the body's immune response against the fungus. Additionally, research into minimally invasive surgical techniques is aimed at improving the outcomes of surgical interventions. As our understanding of pulmonary aspergilloma deepens, we move closer to more effective and personalized treatment strategies, offering hope for improved quality of life for those affected by this unique lung condition.